New tonight at 11, it was supposed to be a new chapter in life. Instead, a 40-year-old Florida man died during a heart transplant operation.
Yeah, his family said it took months for them to learn what really happened on the operating table. Now, they're speaking to 10 Investigates' Jennifer Titus. Here's the perfect heart.
All his life, Noah Leopold was a fighter.
At the age of 7, he got cancer.
He fought and won, but spent life battling complications from chemo. He continued to fight. By his 40th birthday, his heart was failing. He was told he needed a transplant, wanting the operation from cardiovascular experts. He traveled from Florida thousands of miles away to doctors at the Mayo Clinic in Rochester, Minnesota.
The primary value of the Mayo Clinic is the needs of the patient come first.
Noah had needs.
He wanted to know everything.
Even telling doctors in a consultation before surgery, there was something he did not want from the donor's heart. Noah is told by a Mayo ICU doctor in this recorded conversation he doesn't need to rush. There was time, and the transplant team wanted to find him the perfect heart.
Anyone who's had a drug overdose or something like that is considered a high-risk donor.
Not even 2 weeks later, Noah was taken into surgery.
We were told that this was a perfect heart. I think those were the words. This was Noah's heart. This was meant for him.
During surgery, doctors discover the heart is too large. The heart has uncontrollable bleeding, and then just falls apart.
They told us that the heart didn't make it and that he didn't have a heart at all.
Days later, Mayo transplanted a different heart, but Noah suffered a brain bleed.
We never expected to leave there without him.
A future
No,
without their fighter.
it's still hard to believe.
Now, the pain never goes away.
No.
Led them to fight for answers into what happened and why. Our search for answers takes us to the mountains of Idaho.
Who's the deceased?
Where police video reveals Noah received the very type of heart
Suboxone?
he did not want.
Heroin? Is it heroin? Meth overdose.
Noah got the heart of a meth addict.
Brendan Thompson, the family's attorney, brought a federal lawsuit against Mayo alleging medical negligence, negligent nondisclosure, and medical battery. The lawsuit filed claims Mayo denied Noah critical information that he asked about and had a right to know, that the heart being put into his body came from the victim of a drug overdose.
Mayo had an obligation to tell him that, and they didn't.
In its response to the lawsuit, Mayo denied all those claims. In court records, Mayo said it did inform Noah the heart had risk factors for diseases like hepatitis and HIV, and he consented to the operation. Mayo declined our interview request, instead sending a statement that says in part, "We follow applicable medical standards of care, guidance of national organizations that oversee organ donation and procurement, and the privacy rights of organ donors who give the ultimate gift to patients." Digging into laws across the country, most states have a patient's Bill of Rights. Florida's nearly mirrors Minnesota, saying a patient has the right to refuse any treatment except as otherwise provided by law. The responsible provider shall document any such refusal. Is that the patient's right to say that and to know that they won't be getting that heart if they tell their surgeon that?
That's a patient right to express their desire.
Dr. Charles Lambert is a cardiologist and a medical director at Advent Health Pep and Heart Institute. He has nothing to do with the Leopold case, but agreed to talk with us about patients' rights.
There's a lot of shared decision-making there from a social perspective, a medical perspective, and even financial.
Noah's lawyer says there's also something else Mayo failed to tell Noah. The donor heart was being transported via the organ care system known as Heart in a Box. You can watch part 2 of this investigation right now on our free streaming app. For now, I'm Jennifer Titus, 10 Investigates.